Let's talk about ACL surgery. Our techniques for ACL reconstruction have improved in the last 2 decades to make things much more streamlined and improve recovery time. That being said, this is still a major surgery. I need you to remember this is going to be a path that we're going to take together. ACL reconstruction is when we rebuild the ACL by taking tissue from elsewhere and building a new ACL by drilling tunnels into the tibia and the femur. We frequently treat ACL tears this way, as ACL repairs or just stitching the ACL back together does not frequently help. In some cases, an ACL repair may be indicated. That depends on the patient and your individual circumstances. But that being said, an ACL reconstruction is the most common way to treat an ACL tear surgically. When we perform an ACL reconstruction, as I said, we're taking tissue from elsewhere in the body and making a new ACL. There are a few different places we can take that tissue from. That might be from your patella tendon, in which case we're taking just a small bit of your patella tendon and turning that into a new ACL. When we do it that way, we typically take a little bit of bone from your kneecap, your patella, and from your tibia or your shin bone. So there's bone plugs on both ends of that tissue graft. Additionally, you can take it from the back of your hamstring tendon. This could be an excellent graft for ACL reconstruction as well. A third common graft option is from the quadriceps, which is right above your kneecap, and taking a bit of that tendon there can be turned into an excellent ACL graft. The best ACL graft depends on your personal circumstances and your activity level. When we meet in person, we can talk about different options and why each option might work for you. Like any major surgery, there are risks related to ACL reconstruction. Any surgery has a risk of infection. We'll give you antibiotics via your IV at the time of surgery to try and prevent that from happening. However, we cannot make the infection risk zero. We'll also want to be careful about doing anything to expose your wounds to any risk for infection. So we'll make sure we do not submerge the wound underwater before 6 weeks after surgery, although showers will be fine after 2 days. Risk of blood clot can be a scary finding after ACL surgery as well. Blood clots, or deep venous thrombosis, DVT for short, can be scary. They can form in the back of your leg after a leg surgery, and they can go off to your lungs, which can be very dangerous. To try to prevent that, we'll treat with aspirin or another blood thinner to thin your blood and try and prevent that from happening. Additionally, we want to keep you moving right after surgery. We want you moving to keep the blood flowing throughout your body and try to prevent blood clots from forming. So many people will think that they're bedbound after a surgery like this. And the answer to that is absolutely not. We want you moving using the crutches and using the brace just like we taught you in the clinic. There's a risk of nerve injury with any ACL surgery. The major nerves and vessels that give you blood flow to your leg and move your foot and give you feeling throughout your leg are back and behind your knee. Typically, we're not working exactly around these structures. However, in some cases, there may be some risk to irritation or injury. This risk can be higher if we have to do a meniscal repair at the same time as an ACL reconstruction. Some of that will depend on what we find when we go into surgery. There is some risk of arthritis later on in life after ACL reconstruction. For some reasons we don't fully understand, the body may react to having been injured from the ACL by degenerating or thinning your cartilage in between your knees. When that cartilage thins, there's no easy way to get it back, and when it erodes away completely, someone can be what we call bone on bone in their arthritis, where they've lost the cushion or the natural cushion in between their knees. Typically, if this happens, it would be something like 15 to 20 years after your ACL injury. This does not happen to every patient, and every patient who has this does not necessarily need a knee replacement, but it's something that your risk is increased for. There's a risk of re-tearing your ACL. Depending on what you do and what your activity level is, there may be some risk. Different people may have different risks based on what they do and who they are. We found there is a higher risk for those who participate in high-level competitive activity that involves cutting and pivoting or collision. That includes football, soccer, lacrosse, basketball, and sports of that nature. Patients who go back to sport too soon can also be at a high risk. We're going to take our time step by step and get you back to where you want to be. But it's very crucial that we follow the timeline according to how your strength and your range of motion is progressing. People who try to rush to return to sport frequently end up returning with an ACL tear again. And you never want to do a second ACL if you don't have to. The typical return to sport after ACL reconstruction is on the order of 10 to 12 months, but once again, this is based on your personal milestones and timeline. If you achieve the appropriate milestones with your physical therapist and your rehab specialist, then you'll progress on to the next phase, which each phase you increase the amount of activity that you do and increase the amount of freedom that we give you. And once you pass each phase, you move on to the next one.